So we're very bad at doing that kind of thing in Ireland, I think. So I'm delighted. The last speaker, and we're not going to have a question and answer session. We're going to move straight into the panel discussion because we've had question and answers as we've gone along. But I'm delighted to welcome Cody, who's a real friend to the MRCG. She works for the Health Research Board, and she's really taken on the whole issue of PPI, both from an academic perspective as well as from an organisational perspective, and she's really helped to move it along. So delighted to welcome Anne. Thank you very much.
Thank you. Do you answer? Hi. Thank you. Now, where do I get into my presentation? Do I need to get out of this?
Here we are, our IT specialists.
Not even remotely an IT specialist, but okay. And this is just your conference.
Oh, it's just after?
Yeah.
Perfect. Thank you. Great. Thank you very much for the invitation. It's great to be able to talk about TPI here. For those of you who don't know the HRB, we are a semi-state agency under the Department of Health with a remit to fund health research. So we have a very broad remit across any disease area. And we also fund research ranging from laboratory-based research, clinical, population health, health services research, quite a broad spectrum. So just to give you that little bit of background on who we are. What I'm going to talk you through a little bit is the context for us. How did we get into that realm of PPI? We did a survey earlier this year where we're looking for input, and now what we're trying to slowly put together what we're going to do about this area. So we started a new strategy period at the beginning of this year, and this strategy document, Research Evidence Action, contains an action that says provide leadership to shape the review, conduct and governance of research. We're a research funder. I think that behoves us. But there's a task underneath that says very specifically to develop and promote within the HRB and in PPI within the HRB and in HRB supported projects and programs. When we wrote that summer of last year, we had no idea what shape that might take. We really didn't. But we had a very strong feeling that this is an area we just need to do something about more systematically and less ad hoc maybe as we have been doing in the past. There are other funders in Ireland who fund public engagement. SFI and the Irish Research Council have sort of funding in that space. But that's quite different from what we mean here. And we wanted to drive kind of a somewhat different level of PPI. So what do you do if you don't really know what to do? You look at international models. And really in a nutshell, there is of course an awful lot to learn from other countries. But approaches vary hugely. And the one thing is that they're all context specific and they're very, very strong dependencies on the environment. So there are things to learn, but you cannot just copy paste something and hope that it will work here. But it certainly gives you an awful lot of ideas of what you could be doing. The next thing, of course, was to look at supports for PPI in Ireland. It's not that we invented it. So what you can find is a number of really, really brilliant individuals who have been doing PPI on a very, very active basis for many years. Some of them are in the room. But this is a small cohort, and it's very much driven by individuals. So if you want to get beyond that, clearly something else is needed. There are a couple of HRB initiatives that you could loosely put in under PPI. We've had a joint funding scheme with the medical research charities for quite a number of years. We've funded over 110 projects over the years, each with up to €300,000. You know, that's great. But just because something is co-funded with a charity doesn't necessarily make that strong PPI. And we're looking at ways to, in this particular scheme, to improve our approaches as well. We've also had an initiative around knowledge exchange and dissemination, which again yielded some lovely examples of PPI, really nice things. But, you know, it wasn't as targeted, it was sort of somewhat, you know, I don't think that we could just now say, great, tick, done that. Of course, charity-led initiatives, and you know, just the fact that we're coming together here and discussing it, and not for the first time, that's great. And some individual charities have done specific things within their particular constituency. But I think overall, there's still, PPI in Ireland is still quite in its infancy. And this is a picture of how I feel. So, you know, first, very wobbly steps, and we have an awful lot to learn. So, again, arising out of that, the next thing was to put out a survey to look for input both from researchers and from members of the public around how would you support public and patient involvement in research. And just to say, well, first is that the HRB works mainly directly with researchers. They are our direct constituency, researchers and research institutions. We work a lot less with members of the public, not really at all. We have, of course, interactions with the charities, and said, you know, we have the co-funding scheme and a number of areas of interest where we collaborate, but you know, our primary constituency are the researchers, and very kindly a number of charities put out a link to this survey to their constituency simply because we wouldn't have reached an awful lot of members of the public or patients. So I'm just going to quickly talk you through the main results from that survey, and starting at the top and going clockwise. I suppose the first big message, the 6 big messages that came out of this. And the first big message was, there's an appetite for this. Now, this is a self-selected sample of people who responded to a survey with PPI in the title. Okay, so it's not necessarily that you could utterly generalize this. But out of 148 researchers who said, you know, would you be interested in doing PPI, including PPI in your approaches in the future, all but 1 said yes. So, you know, some note of optimism. In the arm of the survey aimed at researchers, we asked, what could the HRB do to help you? And the one item that came really head and shoulders above everything else was practical help. We don't know where to start. So, you know, that was very, very important learning for us. Researchers identified that finding PPI contributors is a barrier for them. But if you're a patient or a member of the public with an interest in research, how do you even start finding a researcher? So for both of them, there is an element of matchmaking that maybe we'll need to look at more in the future. Avoiding tokenism throughout, you know, I think it has been a consistent message on both arms of the survey, and certainly it's something we feel quite strongly about as well. We have no intention of just adding a tick box and wasting everybody's time. Which means that, you know, we're probably, to bring people along, takes a little bit more time than to just say, okay, you all have to do this now. Looking at the arm of the survey that was answered by members of the public, there was very diverse range of different activities that people are interested in potentially participating in, which is brilliant because ultimately we'll need all of these. And we'll need people in engaging in lots of different ways, in lots of different types of research. And the one, again, the biggest concern for members of the public was, and that rings of course a lot with the James Liverpool Alliance approach, is about having an input into and a bigger influence on the prioritisation of research questions. So that's really something that we very much will need to think about. So taking all these inputs, we started looking at, okay, now what can we do about this? And as a funding agency, I suppose there are two different modes that we can look at. One is what we fund, and the other one is how we work. So let's start with what we fund. Out of that first top item for researchers arose the principles for a call that we're calling PPI Ignite, and we put those out for consultation for a number of months of it earlier. Thank you very much for the responses, that's very, very useful. And we are now very much looking to, open that call soon, within the next 4 weeks or so, and with a longish closing time, because we think that people will need to think about it quite carefully. We'll co-fund with the Irish Research Council, who have come on board during the consultation period, which is great. And the whole purpose is to support PPI in HRB host institutions. So this is really about an institutional application. We do not want 5 competing applications from researchers in the same institution, and we'll actually make that impossible. But we want the people in one organisation, in one institution, to come together and really consider very, very well how they would like to promote PPI and bring along researchers in their institution. The objective is to build capacity for PPI in health research in Ireland, and also to improve the quality of PPI approaches so that we improve and promote interactions that are seen as fruitful and beneficial by both researchers and PPI contributors. Because if it doesn't work for one side of the equation, then it doesn't work. We need a champion in the host institution. We need, we need an organisational buy-in, basically, is what we're saying. And we're looking at a funding envelope of €350,000 over 20 years. So we're very excited about this. It's it's something we have never done before in that format, and you can plan and think so much, and then at some stage you just need to go and do it. There are a number of deliverables that we very much associate with this. This is about supporting a variety of different projects. I do get it that there would be a number of individual projects that could each suck up all of those resources just for the one project. This is not what this is about. It's about broadening out, it's about getting more researchers involved, supporting them to do, to include PPI and to start thinking about this from the beginning. And a very, very key point here is that this is not a place to outsource your PPI to. The responsibility for the PPI remains with the researcher, very, very clearly. The PPI Ignite team will collaborate with researchers, and they will help them and will support them. And there'll be a really useful sounding board, and there'll be practical help to some degree. But it's not the place where you go kind of the week before the closing date and say, just give me something. It's not going to work that way. Of course, there'll be an element of training. I think that in itself is an element of awareness raising, but obviously it's needed as well. And I think what's also quite important is that if we are putting a number of teams into different organisations around Ireland, we need to link them up. You know, it would be silly to try and reinvent everything in every place. Yes, each institution is going to be somewhat different. There are always idiosyncrasies and there are always local differences. But at the same time, there are also communalities and there are people struggling with the same issues. So sharing information is going to be really important. We would like to make that network of practice a lot broader than just the people who are working in those awards, and open it up to other people who have an interest in that space. And just share good practice and bounce ideas off each other. In terms of other HRB schemes, I mean, we've always been perfectly open to including costs associated with PPI into the budgets of any of our schemes, really. Maybe we didn't emphasise that terribly much, and maybe we should do that a little bit more. But what we've recently done as well is that we've increased the budget caps for some of our schemes, recognising that PPI is one out of a number of things that we now ask researchers to do a lot more of. And it does potentially come with a price tag. That will vary very much depending on the project and depending on what exactly it is that they want to be doing. But, it needs to be resourced. And actually, the request for specific funding was right middle-ish in the survey. So this is not really, specific funding is not so much the barrier at this point in time, at least. I think it's more about where do I even start? The second part of this is about how we work. And, one of the big things as a funding agency is about the way you influence people is through your funding processes. Clearly, if you do something as a funder, just as you were saying that the NIHR has driven so much of PPI in the UK, as a funder you have a certain leverage there. And I think we do want to use that leverage, but at the same time, the notion of having, and peer review processes are kind of the big thing in a way. But at the same time, the notion of having a dedicated PPI review as part of the funding decision was utterly scary for researchers. And ranked lowest, unsurprisingly, in the survey. And that's quite understandable, because if people don't really know what to do, and now you're going to be judged on it and potentially not be funded because you weren't great, that's a very scary prospect. So we're trying to combine those two things. On the one hand, acknowledge that there is a genuine and I suppose justified reluctance for researchers to be judged on the quality of their PPI approaches at this point. But on the other hand, use our processes to start driving the engagement with PPI as part of the overall development of research. So to balance those two things, we're in the process of developing a pilot within the HRB, where we're looking at what we call a PPI contributor pool, where we're picking a particular scheme, and we'll look at delivering dedicated PPI reviews written by PPI contributors, but outside, at this point, in the first step, outside of the scoring process, outside of the decision-making process, to provide feedback and also for us to learn an awful lot about, does this work, does this not work, how do we even go about it? We can't guarantee coverage or anything like that at this point. So we're trying to develop a very stepwise approach to this to enable researchers who have honed their other research skills through feedback that they would have, you get feedback on your scientific work all the time. But they have never really gotten feedback on their PPI approaches. So we're trying to address that. I think we need to be very clear about our expectations. Also very much to those PPI contributors who hopefully will be coming on board for this pilot, because if people think that they have an impact on the funding decision, that would be unfortunate, because that would set us up for disappointment. This is a major challenge for us, both logistical, because how do you even start? We get 450 applications a year. Okay, how do you get PPI contributors to review all of those? That's it's not going to just materialise overnight. But it's also very much a conceptual shift for us. And what do we need to do? What training do we need? What approaches do we need? How do we manage this whole process? How is this going to work? There's an awful lot that we need to think through. And of course, we've been discussing this with colleagues elsewhere, in particular in the UK, but I think there's still a hell of a lot to work out. In terms of how we see this process going over a number of years, we started to include a question about PPI in our application forms in 2014. And that's a very high level, is there anything you're planning to do in this space question. And it prompted a little bit of a ripple at the time, but that's certainly not the full solution. What we're looking at now is to provide dedicated feedback to the researcher only, and we will uncouple that in terms of timeline. We will uncouple it from the peer review process. So you're not having, there's no particular advantage within that competition for being somebody who gets feedback, because as I said, we can't guarantee coverage. Really, we don't know. It would be great if we could, but we don't know. And we'll make sure that it does not at this stage influence the funding decision, but it will improve the expertise. And in the next step, it goes to the panel. And in the next step, it's actually included into the scoring system, into the panel meeting, and at least in the schemes where it fits and sits well naturally. If that's all HRB schemes or not, I can't say at this stage. But we very much want to feel our way through that, and plan as much as we can for those steps. But there's also going to be a big element of just saying, we have to jump and try and recruit people and try and work out, with the help, hopefully, of the PPI contributors, how we address that, what mix and all those things, how do we match people with applications, all of those complicated things we'll have to work out. And I suppose next thing is really looking at assessing how that works, that pilot. If we only get 5 people who volunteer for a contributor panel, then we have a problem. Feasibility of wider rollout. We need to look at what PPI Ignite as a scheme is doing, how that's working, how that network is developing. We've started to talk to our communications team about a number of awareness raising events and with potential maybe around some of those matchmaking elements. And then there's going to be a little bit of looking where the road takes us, because you know, I think we're all very much on a steep learning curve here. I certainly am. That's it.
Thank you. Thanks, Anna. Not only in terms of giving us the progress, but you know, when announcing the Ignite project and giving a sense of what it would look like. It's you know, resources for this, so it's really a kind of exciting time, and I hope people will apply for that funding. Just time for a question or two before we move into the final panel session. Just introduce yourself.
Catherine Corrigan from Dublin City University. Thank you for a nice presentation. I'm at a bit of a loss to know, you know, for example, if the researchers were lucky enough to involve a lot of people initially for the proposal, you know, isn't it a disappointing situation maybe if the proposal didn't get funded then, that all these people have been, you know, geared up towards doing a large study, whatever. You know, so I'm a bit of a loss to know, like, do we involve a lot of people initially, or just, you know, because you want to leave it open for everybody and have fair participation. So
yeah, and that is a conundrum, yeah, I think. Well, it's very hard to give a generic answer because clearly, it depends very much on what it is you're doing. I think this notion of, is this a relevant question? Is this a question that patients or members of the public, depending on which particular area you're working in, won't answer it? You know, has there been a James Lind Alliance priority list developed, or you know, do you have an opportunity to talk to patients or service users here that could inform your particular research? I think that notion is something that, you know, I personally find very important. And it really strengthens the proposal as well. I think it's, you know, to be able to show, we give those talks about grant writing, and there are a number of reasons why a grant might not be successful. And I think that the deadliest is the, so what? You know, why are you doing this? And that's kind of the, you know, the ultimate killer, I think. So to show that actually I have a very fine reason for doing this, I think is a real strong point. Now, that doesn't guarantee funding. And whichever stage we'll be at with including the PPI element in it, there will always be a strong scientific review process, and it needs to be. It's about integrating those two, and it's about having an additional piece of information and of input into that decision-making process. I suppose, yeah, I think if you can have a long-standing partnership, that's ideal, but that doesn't work in every circumstances. And having a lot of people lined up, I think, again, it's about expectations, and it's about saying, okay, we're writing this application. The timelines are actually typically a lot longer than a member of the public would typically suspect. From, you know, beginning to plan the project to start of work, if it's been successful, and also just simply the concept that this is a competition, and you know, it may or may not be successful. I think that's very important to be clear about that.
thank you.
Okay, thanks very much, Anne. Give him a round of applause, please. I'm delighted